Hey friends, welcome. Joe DeMattos here at HFAM, the Health Facilities Association of Maryland. And we're here again for one of our chats with a really intriguing company. I was introduced to them by a trusted partner. I've had a planning call with them. And quite frankly, I am really impressed with all the things going on at Eurofins. So Annemarie Watson and Sean Murray, thank you so much for joining us today on this discussion with HFAM and our members. Welcome.
Thank you.
Thanks, Joseph. I'm excited to be here.
Yeah, I want to just get right straight to it. And I guess maybe, Annemarie, I'll ask you first. Just let HFAM members and others in the sector, let them know who, what, where, when, why. Tell us about Eurofins, would you?
Sure. So Eurofins is really a global network of laboratories, and we focus on food testing, environment testing, pharma testing, clinical diagnostics. We've been around for more than 30 years, and we have more than 47,000 employees across 800 labs in 50 countries. So we have a broad footprint, and we've been at the forefront of COVID-19 testing and have 8 labs in the U.S. currently doing actually COVID-19 testing. We were one of the very first to be awarded our EUA from the FDA back in March. And so we're proud to do that, as well as the Safer at Work program that we've launched, and we're happy to talk a little bit more about, which is a more cost-effective and innovative and combined approach to COVID testing.
Well, Eurofins is a big organization with a very entrepreneurial approach, and we appreciate that you brought your Harvard education background to the sector because we could use you right now. Sean, tell us a little bit about Eurofins and what brought you to the organization.
Yeah, sure. Well, you said it. It's a very entrepreneurial company. Innovation's kind of in the blood, and that's been helpful as we try to all attack this COVID challenge, because the challenges are very unique and require new approaches. Some of those, Annemarie mentioned Safer at Work, where we're trying to detect in many different ways the virus and come up with more cost-effective ways to combat it. And that's the reason why I joined, is the entrepreneurship and innovation that the company is really good at.
Well, I appreciate that. And we appreciate that you're bringing your expertise to the sector as well. You know, we are in a really once in 100-year situation, and the work that we are doing on COVID, and I hate to use the phrase, but the new normal of COVID will likely be amongst the most consequential work that we ever do. And so it's important to learn about Eurofins and what you have to offer. And I'm intrigued, I'll ask both of you this, first probably you, Annemarie. I'm intrigued by your PCR testing, your antibody testing, and also, quite frankly, your wastewater testing. Can you tell us more about that first, Annemarie, and then I'll throw it over to Sean?
Sure. So for PCR testing, we offer, it's an FDA-approved PCR test that detect really the active infection. And so we provide the test kits and the nasal swabs, all the supplies, and then run the test and report out. We are typically within 24 to 48 hours turnaround time for all those tests. We believe that, you know, absolutely, you want an answer to folks as quickly as you can get one. And for the most part, I think we are 97% actually within that 48-hour turnaround time. We do PCR tests both as far as individual PCR clinical diagnostic tests, but then also pooled tests, which offers a more cost-effective way to test a broader set of employees if you're within a relatively low positivity rate. And then for antibodies, we do IgM testing, which is usually present 2 to 5 days post-infection, and then IgG testing as well, which usually comes 2 to 4 weeks post-infection. And, you know, that's really not diagnostic from a perspective of do you have an active infection, but really gives you a feel for how much of your population has already been infected. I'll turn it over to Sean for a little bit on wastewater.
Yeah, Sean.
Sure. Yeah. So one of the other approaches we use, we call it sentinel testing, where you're looking into a number of places. It could be on a surface or it could be on a mask. And in this case, in wastewater, you're actually looking into the waste from a nursing home, a building, an operation, what have you. And we know from the literature that people who have COVID-19 shed it in their waste often. And it's one way for inexpensive in terms of cost per person, an inexpensive way to detect if you've got it in your presence. And, given that the dollars aren't always getting to the right places, sometimes that cost can really be an important factor. And we have a lot of experience testing wastewater and other applications. And so this one made a lot of sense considering we were already doing COVID clinical testing. We're already testing water in a million other circumstances. So testing for COVID and wastewater is really right up our alley.
Sean, I got to tell you, that's one of the most intriguing things about Eurofins. We have a number of labs that we're working with, another number of companies that we're working with, and we need them all, quite frankly, right now, because I think our commercial capacity in Maryland and across the country is strained, and I think it's only going to get more strained in the coming weeks in the fall. And we also have organizations that we work with that we trust on testing surfaces. But I got to tell you, this idea of being able to test wastewater for shedding, I don't know of anybody else that's doing that, just period, hard stop. And when you consider that Eurofins can do the PCR testing, the antibody testing, and the wastewater testing, as well as playing a consultative role with regard to surfaces, I think that's a unique package. And I think what Annemarie brought up is really important. I'm very concerned about actionable results and getting clinical results back in 24 or 48 hours, because we really need them in order to clinically manage the virus. At least that's what the physicians and the epidemiologists are telling us. So powerful stuff. Sean, you also have a program where you're doing really almost scholarly town-to-gown research, where people at no cost to them can send, assisted livings and SNFs can send to you used and discarded masks, and you test them. Tell us more about that. What's that about? Why is that important?
Sure. Well, we found that people who have active virus do show it on masks. As you imagine, they're breathing on them all day. And so, as you said, we need all the commercial capacity we can get. And there's lots of different applications from point of care to PCR. And I think this is one more that can work for some people. Most senior living facilities have most of their staff in masks. And I think the niche that this could replace for some people is that it can be lower cost. It's done in one of our environmental labs, so they don't have as much of the typical cost structure that a clinical lab would have. And then there's also no need to have sample taking and nasal swabs and that sort of a thing, which absolutely have their place. But there may be times when that's not convenient, not easy to do. And testing a mask might be easier. And it's literally as simple as that. Working with us, sending it in a plastic bag to the lab that does that testing, and we give a result like you would with the clinical test.
We should track all of that data. How can skilled nursing and rehab centers in Maryland reach out to you, Sean, or Annemarie, or Eurofins?
Absolutely, yeah. So the easy thing to do, most of us get started on the internet, eurofins.com. There's COVID-19 links right there, and they've got all the different aspects we talked through: wastewater, masks, clinical testing. And Annemarie and I are both always eager to work with you directly. My email address is seanmurray@eurofinsus.com, and Annemarie's is Annemarie.Watson@eurofinsus.com. And we would be happy to help anyone we can in this fight. We're really after trying to contribute, and we know we all need to be in it.
Well, we can't thank you enough. When we finish up this video and get it out, not just to HFAM members, but to the entire sector in Maryland, we'll make sure to include the links to Eurofins and your email addresses. Annemarie, is there anything you'd like to add?
No, just thank you for the conversation today. And as Sean said, we're eager to help out however we can, and agree it is an interesting time and a challenging time. And, we're trying to be as creative as we can with some solutions that will solve problems in a timely way.
Well, we can't thank you enough, each of you individually, Sean and Annemarie, Eurofins as well. The truth is that we are getting better at fighting this COVID virus, but we are going to continue to be fighting it until there's a broadly available vaccine. Because of the nature of post-acute and long-term care, the people who are receiving quality care in our sector are more susceptible to this killer virus. So we need to be more vigilant. I'm sure of one thing: we will get through this, and a secret to getting through this will be our working together. So I can't thank you enough. So friends who have been joining today, this has been a chat with Eurofins and your Health Facilities Association of Maryland. Thanks for all you do. Be well.